Pembridge Hospice, our aim is to support people to live life to the fullest, but we also help people to prepare for when they become less well. It is about living with dying, not ignoring dying is happening. For Dying Matters Awareness Week 2024, the theme is the language we use to talk about dying matters, which looks at language we use and conversations that we have when talking about dying to our patients, carers and their relatives. Our team at Pembridge have put together this short video to demonstrate how we approach such sensitive conversations.
To me, the most important aspect when talking about death and dying to someone is to acknowledge that we're speaking to an individual and then we're halfway there. Once there is respect and dignity, we're talking human to human with compassion, and the actual words can become less important. The only right words to use are those words that the individual we're talking to chooses to use. Finding out their preference to language and approach is important wherever possible. Remembering that you are offering an opportunity to talk about death and dying, which the person may accept or decline. It may be offered at another time, revisited when the timing is acceptable to that person. It may never be acceptable. There are other ways other than talking in which people release their thoughts, emotions and feelings around death and dying, which are therapeutic in their own right. It may lead to further conversations, and it may not. Talking about death and dying is not for everyone, and that is okay too.
When I attended the training, someone said this phrase that I will never forget. She said, "We cannot change the outcome, but we can change the journey." With our patient and their family's journey, the way we talk about dying matters. Timely discussions and the language we use about death and dying are very important, as this can help to support them to meet their individual needs, such as making sure that their wishes are carried out and respected. I believe that as healthcare professionals, we can support people and make their journey a little easier.
Hi, I'm a massage therapist and aromatherapist. My purpose is to help patients relax, feel more comfortable, both physically and emotionally, with the power of smell and touch. Usually, I let my hands do the talking. However, occasionally patients may ask me, "Why is this happening to me? Why now? Why me?" To which I only reply, "I'm afraid I don't have any answer to that." And then I pause, because I believe that sometimes just listening is more important than trying to find the correct answer.
Hi, my name is Bronwyn and I'm a creative wellbeing teacher at Pembridge. And often people come to me who haven't done anything creative for a long time, or they're looking for some distraction or something to share their passion or to make something beautiful for a loved one. And my role is very much to support people where they are and to help them to feel well in themselves in whatever activity they decide to do.
We are the palliative care nurses, the specialist palliative care nurses based in Pembridge Hospice. We visit patients at home to assess them for their needs, their symptom management, and for their holistic needs. So we assess them for care needs, for symptom control, for any issues that they have regarding their palliation at home. And throughout the assessment, when we visit, we talk also to you about death and dying and about all the services within the community that supports and guide you throughout death and dying process.
Hi, we're the Pembridge therapy team. As a therapy team, we work with people to adapt to changes and to find practical solutions to personal goals. Sometimes people find it hard to think about the future and plan for how they will cope as their condition progresses. We explore what people understand and expect about their condition. Some people don't want to talk about the future, so setting goals can be difficult. But we can ask them, what matters to you?
Goal setting in palliative care should actively invite uncertainty into the conversation but preserve hope. Acknowledging that we cannot be certain what the future holds is honest and open, and welcomed by patients and families who recognise the truth in this. An important strand of rehabilitative palliative care is parallel planning, the process of actively acknowledging and planning for two or more possibilities at the same time. We can talk about hoping for the best while planning for the worst.
For example, a person's goal may be to walk to the park independently. We explore good days and bad days, and the need to actively plan alternatives for days when the person is feeling less well. So we might plan to provide a wheelchair as a backup plan on the not so good days. By having these conversations and planning for several scenarios, we can allow the person to consider the possibility of deteriorating in a safe way and help prevent crisis situations which put the person at risk.
As we know, is a difficult conversation, but one that we'll all have to do at some point in our lives. As a team of palliative care social workers, we support families and significant others to understand the various tasks that must be conducted when someone dies, such as accessing benefits, liaising with funeral directors, housing departments, and utility suppliers. Not only do we offer the practical support, but we also offer listening support during this difficult time.